quote that we're going to take into this next segment that I am hyper excited about, and that is from Thich Nhat Hanh, and he says, "Community is the guru of the future." And if you've been watching us at all, you know that community is a massive part of what we're doing here, building communities of physicians, building communities around practices. And I know a lot of you have been waiting for this. I gave a little hint about this on the end of the June functional forum about the fact that we wanted to bring an alternative, an affordable alternative to health insurance. It's the missing piece that's really keeping a lot of people out of the system. And so it's my absolute pleasure to introduce the program director of a new alternative to health insurance that is not only affordable, but also is a great fit for patients and doctors that love integrative and functional medicine, and for patients too. It is Liberty Direct. And on that note, I'm going to introduce the program director, the man that brought it all together. He is Mr. Tom Blue. Tom, welcome to the Functional Forum again.
Well, I'm glad to be here, and this is a topic that I've gotten increasingly excited about talking about, as it's taken the better part of a year to kind of put this together, and I have a feeling that it's going to solve a number of very important problems for the functional and integrative medicine kind of movement, and in the process do some fantastic or provide some fantastic savings for patients. So I'm thrilled that we're talking about it.
And how important to you is it, Tom, that it seems like the reason we're excited is because it's all based on community. And so, rather than me share about it, because, you've been in the trenches with this, and, Tom and I first spoke about this back in January, and I'd heard about some ideas with it, but I think what he's put together is really revolutionary. So take it away, Tom.
Well, so to understand this, it first helps to kind of talk a little bit about the problem that creates the context for it, and this is something I was grappling with myself as somebody paying the freight on my own health insurance for a family of 5, and so just if we advance to the next slide, we'll see sort of an articulation of some of the problem issues that I was struggling with. But basically, what we're seeing over the last since really this healthcare reform legislation kicked in, it's just astronomical rates of inflation in our healthcare insurance premiums. And so as of last year, I myself was paying $767 a month for a healthy family of 5 to have a $12,400 deductible policy and an excruciatingly narrow network of practitioners or providers, physicians that I could choose from. And this is not in any way a circumstance that was unique to me. And as I looked at it, and as I look at the year-over-year premium inflation that all of us who are paying for our own health insurance are facing, you can't help but to kind of observe that as our premiums keep going up, as our deductibles keep going up, the actual money that we have at our disposal to invest in health gets eaten up by a mandate that requires us to purchase health insurance that's just excruciatingly expensive. And so I started doing research on this at the end of last year. I was reading a book by a healthcare policy analyst on essentially the self-pay patient movement, which, as this is becoming a bigger and bigger problem for more and more people, is a topic that's more and more on the minds of folks, particularly those of us under 65. And I come across a chapter on something called healthcare cost-sharing ministries. And as I started to read more about it, what I discovered, and I've learned that most people are kind of like me; they'd never heard about this before. Although more and more of us are hearing about it, all the time as this problem becomes more and more acute. But basically, for generations, literally, certain circles of people in the Christian community have been taking it upon themselves to sort of share the burden of healthcare expenses, and this is a practice that sort of sprung up kind of informally and over the course of the 1900s. By the end of the 1900s, had become fairly well organized, and there were a handful of different organizations that sprung up to kind of bring order to the practice and facilitate the movement of money amongst people as healthcare needs arose. And so along comes 2010 when we're all required by law to purchase health insurance, and these folks very easily kind of raised their hands and got an exemption to the ACA mandate to purchase healthcare insurance. And so in doing that, they very unintentionally created what is a very interesting opportunity for all of us to kind of revisit the way we manage the risk of healthcare expenses and the way we manage these healthcare costs. And so anyway, I started to do research into these. It was roughly 4 organizations that were kind of leading this. And what I discovered is that 3 of the 4 are rather intensely religious organizations, and you've got to be a pretty devoutly practicing Christian with in some cases even a letter from your pastor to sort of get into one of these organizations. One of them, however, in 2012 was rechartered by the Mennonite Church to be open to everybody. And the shared belief system has a great deal to do with belief in the right to practice religion as you see fit, but also a shared belief in personal responsibility for health and essentially taking care of your body, which is something that a great many of us, particularly in the functional and integrative medicine circles, would also strongly share as a belief system. And so anyway, I joined this thing for myself and my own family, because if I have to kick the tires on this, and the way it basically works, the experience as a consumer is actually very familiar if you've ever had health insurance before. I mean, you pay a monthly amount that is called a monthly share amount into essentially a pool. That money, when medical expenses arise, in someone else's case, that money is moved, just like it has worked for generations, although it's done all online and electronically, kind of invisibly to yourself. But anyway, the money moves around to people that have medical needs in any given month, and this company, Liberty Health Share, that has largely automated this experience, has really perfected it to a point that I have personally have found it to be quite elegant. So anyway, similar to having had health insurance, there is an amount of money that you're responsible for every year, called an annual unshared amount. In some ways, it's analogous to what we've experienced in the way of a deductible. And once you hit that amount, the expenses are covered by through sharing. And you have a card in your wallet. You go to the doctor. You present the card. At least my experience has been that doctors' offices are beginning to become aware of these things, recognize healthcare sharing organizations as actually pretty favorable payers, and they will bill, in this case, Liberty directly. Liberty will then pay them, reimburse them directly. So it's a very comfortable and familiar experience. In the event that it does not, that you go to a doctor's office that doesn't want to bill Liberty or what have you, then you would pay the bill yourself at whatever the self-pay rate is, and simply submit the invoice for reimbursement to yourself. So that's kind of how it works. Now, what I'm implying, but haven't said specifically, is that because this is not insurance, and because this is the mechanics work as I just described, there are no more concepts of a network. Which, again, for those of us that are interested in both receiving care as through a functional or integrative medicine provider, as well as for those providers themselves who tend to be independent or small group operators that can often be excluded from these networks, that doing away with the concept of a provider network is a wonderfully kind of favorable thing for the functional and integrative medicine movement. So, advancing on to the next slide, the idea that kind of came to me as I was experiencing this as a consumer was to approach this company, Liberty Health Share, and speak to them about creating a version of this product that was uniquely suited specifically to functional and integrative medicine practitioners, and even more to provide certain advantages to those that want to engage with patients on a subscription or a membership basis. And so, as we've talked about many times before, even on this show, I'm a strong believer in moving away from, particularly at the primary care level, the fee-for-service model, particularly functional medicine, and have developed a strong bias for practices that operate on what's called a direct primary care model, or a retainer type of an arrangement for keeping the relationship sort of on an evergreen basis, and not providing or producing a financial obstacle every time you want to engage in a healthcare encounter. And so anyway, so Liberty Direct is the product of that creative thinking. We conceived of a healthcare sharing arrangement that that was designed specifically to work with, or to work particularly well with this particular flavor of primary care practitioner, and then deploy it on their exemption and their administrative framework to make this a reality for patients. And so, what makes it unique are three particular characteristics. And so when I joined, I immediately met with a fantastic kind of financial benefit. I was paying $767 a month for a $12,400 deductible policy. I joined Liberty and immediately was paying $449 a month with a $1,500 annual unshared amount. And so the economics right on the surface of it for me were quite staggering. And so what we did was we took this product that I had subscribed to, and we added three modifications to it that each of which are very intentional and very important. First of all is that for patients of direct primary care practices, those of us who are paying a membership fee to engage with a primary care doctor, Liberty also sees eye to eye with this concept of the importance of that relationship, lowering the barriers, and asking and encouraging primary care doctors to sort of break with the having to come into an office as an example just to access care. So so encouraging telemedicine visits and virtual consults, things that are very difficult to get reimbursed for in a fee-for-service insurance-based environment. If you belong to a direct primary care practice, out of the monthly share amount that you pay in, Liberty will subsidize your membership fee to the tune of $60 a month for an individual, $80 a month for a couple, or $100 a month for a family. And so for practitioners for primary care doctors who are thinking about moving to a membership-based model, this subsidy in many markets is close to, if not as much as a lot of doctors are charging for direct primary care. So it takes almost all of the financial sting out of it for the patient. Then, of course, when you combine that with the premium savings, it literally makes it cheaper for the consumer to engage with this type of practitioner than it was to engage on a fee-for-service basis with a traditional health insurance product. The second attribute of Liberty Direct actually arises from something that I observed and was immediately struck by in kind of looking over this particular healthcare sharing organization, which is for practices that have health coaches, they will compensate the health coach or the practice for providing coaching to certain Liberty Direct members. Now, the way this works is that if you join Liberty Direct and let's say you have type 2 diabetes or hypertension or you're a smoker or you're obese, about 7% of their applicants are accepted on what they call a provisional basis. And so provisional members pay an extra $80 a month for their monthly share amount. And out of that $80, before I ever met these folks, Liberty would go and hire them a health coach from a company that would then work with that patient and coach them back to health. And when they achieved their health goals, then they would be the $80 extra that they're paying would go away, and they would be reinstated as full-fledged members. And so the modification that we made to Liberty Direct, recognizing that so many functional and integrative medicine practices have a lifestyle medicine health coaching component to them, is that the money they were paying for sort of a corporate health coach would be paid to the practice, which amounts to $55 a month for coaching these patients back to health, which is another wonderful way to create an income stream and underwrite that very important health coaching function. The third and final characteristic that we decided on actually relates back to something that aligns very nicely with the Liberty value system that again existed since the 1990s when they were formed, which is a strong bias in favor of nutrition over chronic dependence on medication. And so in that vein, they decided that they would create a product that essentially treated physician-grade nutritional supplements when prescribed by a trained practitioner. So in this case, the practitioner would need to be trained through the Institute for Functional Medicine. They would reimburse nutritional supplements on the same terms that they reimburse pharmaceuticals, which is to say that when those are purchased within 45 days of a visit or an encounter with a practitioner, they would be reimbursed. Which, as we all know, nutritional supplements can be incredibly powerful tools for restoring and maintaining health. Oftentimes, they can be cost prohibitive And so this is a provision that makes that kind of evens the playing field between nutritional supplements and pharmaceuticals. So those are the three attributes of this new product that we've created. Now, all of that having been said, the thing that's most staggering really is the economics of it all. And so in terms of the cost, unlike insurance, which is the costs are derived out of very rather complicated math, what you see here is a table that explains the monthly cost. So for an individual under 30 years old, it's $149. If you're over 30, it's $199. Couples, $249 and $299, and a family is $399 and $449. And so it's as simple as that. The only variation on that would be if you're a provisional member, you can add $80 to that amount. And like I said, about 7% of their applicants wind up in a provisional status, which today, relative to today's insurance premium numbers, are these numbers are staggeringly affordable. Now, what's also rather fascinating about this, and to me is also rather enlightening when it comes to sort of processing and digesting the inflation that we've seen in our insurance premiums in recent years, is that these monthly numbers haven't changed since in 5 years. And so, in any case, it's an unbelievable thing to see the complete absence of any inflation in the last 5 years and what they've had to charge on a monthly basis to do this. I'm going to talk a moment as to how this could possibly be so. So the unshared amounts. Again, this would be to folks who've had insurance in the past. This would be something that you would probably equate to the concept of a deductible. What it looks like is for an individual, it's $500. For a couple, it's $1,000, and for a family, it's $1,500. And so it's again, if you kind of compare that probably to what your deductible is today, particularly if your premium is somewhat low, that tier of numbers is staggeringly affordable by comparison. So anyway, moving on to the next slide, because I want to leave some time for questions to the extent that we have any. The biggest question that I have been receiving about this is essentially, if this sounds too good to be true, how can it be so? And I've kind of grappled. I mean, quite frankly, just for myself in deciding to use this for my own family, that was kind of the first thing I thought of. But as I dug deeper to understand how this is possible, I have discovered that it's actually very easily explained. Number one, by law, a healthcare sharing organization like Liberty has to be a 501c3 nonprofit. So nobody there is making $30 million. They don't have networks of brokers that are making commissions on their sales and out playing golf all the time or whatever on these annuity income streams from these huge commissions. We don't see them advertising on television. They don't have huge marketing budgets. These are things that sort of spread by word of mouth. In fact, their total administrative cost per household per month is $24. So it's a very lean and efficient type of an organization. So that's number one. Number two, this is something really designed for people under 65 years of age. So they don't have a Medicare supplement policy. They're not dealing nearly as much with kind of end-of-life issues and things that affect folks as they really age, and so steering around that is something certainly that saves money for them. They also don't have to accept everybody, which is something that sort of used to be the case, but we've kind of gotten accustomed to that not being the case with healthcare reform. So the statistics are about 3% of people who apply are just flatly rejected because their health profile or disease burden is just something that would likely be unmanageable by the program. As I said, about 7% of members are accepted on what they call a provisional basis. They are charged an extra $80 a month, and then another 5% of applicants are accepted with what they call a pre-existing condition. And so the way this works is if I had a heart attack last year and I joined this year, they would accept me, but they would say, okay, we're not going to pay for your heart attack if it happens again this year. Next year, we'll pay only $25,000 toward your heart attack if you have one. Year after that is $50,000, and then the fourth year, you're a normal member, and everything is covered. So they sort of stair-step their way into covering certain pre-existing conditions. I mean, as you can tell from the statistic, it's not they don't draw a very hard line in terms of forcing people into these buckets. I mean, we would think if obesity is an issue that nearly half the population would be provisional, but in fact it's only 7% when you combine obesity, smoking, hypertension, diabetes. So anyway, I always encourage folks to to simply apply. There's no cost to applying when they look into it and see if you have any questions about this. Then just simply see what the status is of your application and whether you're let in or not. So anyway, that kind of explains how it's so affordable. If you turn back the clock, it's really interesting. When you think about this 5 years ago, these prices haven't changed for 5 years. So if you dial back the clock 5 years and look at them, they wouldn't look nearly as remarkable as they do today in light of 5 years of kind of compounded inflation. But if you think about the actual inflation rate of healthcare services, the cost of healthcare itself, the unit of care of an office visit, an MRI, hasn't gone up, hasn't doubled or tripled in the last 5 years. Our premiums have, but the cost of care has not. And so this is something that seems much more closely tied to the actual cost of care. And coming back to this concept of community, if you can, and what we're doing with this Liberty Direct program is we're promoting it to people who are uniquely health conscious and uniquely kind of enlightened in terms of their desire to take care of themselves through a deeper relationship at the primary care level and through use of functional and integrative medicine principles. And so, if you add to that, and I'm going to be fascinated 3 years from now to look back at the actual claims experience of this particular community, because my hypothesis is that this is a group that's actually going to continue to see no inflation in these rates because of the way we all take care of ourselves. So anyway, as a next step for folks who are interested in it, it's a tool that would be if you're trying to sort of screen yourself out. If you're under 65 and you are carrying most of the load of your health insurance costs, this is certainly something well worth exploring for yourself. If you are a practitioner and you either have health coaching capabilities, you have IFM training to prescribe supplements, or you are interested in or do have a direct primary care model, this would be something. It's free for practitioners to affiliate with this and to become a part of it. So I mean, there's absolutely no barrier to doing it. And so it would probably make sense to go and explore that for your practice and thinking of it as a growth engine. And even if you're not in this category of practitioner, but you recognize that your patients, like many of us, every year facing higher and higher insurance premiums, have less and less to actually invest in health as you're delivering it. This is something I think that's just good to spread the word about. So because again, it kind of puts money back into the healthcare wallets of patients to invest in real health. So anyway, that's the story in a nutshell.
That's awesome, Tom. And before we go any further, I just want to take a moment for a round of applause for Tom and everything else there. Look, I met 1,000 practitioners, and the biggest gripe, if you could make a list of gripes, was that insurance doesn't work for me. And I think this is a huge missing piece, and I just want to share my appreciation for you, because I think this is a huge thing that we're unveiling here. You'll see later on in the month with what we're doing with the summit, we're pushing it because we just feel like you're right. This is, if all the healthy people could jump on this bandwagon, then it saves everyone a lot of money. And for the practitioners that are listening, for me, the biggest thing is that if your deductible goes from $800 a month, or your you don't call it that, your unassessed amount, your monthly contribution.
Yep.
Yeah, if your monthly contribution goes from $800 to $400, there's money left over to pay for cash services, never mind everything that's going to be covered in Liberty. And I think that's the biggest value proposition for people to think about. If they're paying $800 a month for their family every time, the amount of available income for cash services is not very high. But if you can slash that out, I just think that's a real value proposition for all the practitioners that we're working with. I think that's huge.
James, I one of the things that as folks are listening to this that is also a common misunderstanding that I'd love to detonate right now before emails kind of flood in about this is, number one, if you do not have access to a Liberty Direct affiliated practice, as I myself in Richmond, Virginia, where I live, do not at this moment. This is this is still as accessible to you as it is to somebody in one of these affiliated practices. So don't let that stand in your way. One of the most common, we've been getting flooded with requests for folks to find a Liberty Direct affiliated practice in their area. The sequence of events is number one, apply and join Liberty yourself. Once you do, then they will, they will reach out. If you don't have an affiliated practitioner in your community, will certainly reach out and start looking for one. But I've just noticed that there's a somehow in I guess as people sort of skim over the site, they come away with an assumption that if they don't have an affiliated practitioner already, that they can't partake of this, which of course is not the case. It's really amazing. I mean, we piloted this in June for about 3 weeks, and very quickly it became clear that this is a product that they needed to put the infrastructure in place to support, which they now have. We relaunched it about probably 3 weeks ago, and affiliated practices have sort of flooded in with registrations, and I would say in advance that if this is something you wind up wanting to do for your practice, give us the grace of a few days, if not a week or so, of processing kind of the inbound applications and what have you, because there's a bit of an implementation step involved in getting practices up and running, and kind of effortless on the part of the practice, but some setup work and getting the practice integrated with the Liberty kind of eligibility system. So anyway, as people look at it, keep those thoughts in mind.
Awesome. We've had a couple of questions, Tom, here on Twitter. Dr. Ellie Campbell, who's from Atlanta, runs one of our biggest meetups there. She says, questions to Tom, what is involved with registering a practice? Can you participate and not bill insurance?
In fact, yeah, whether you do or don't bill insurance makes no difference whatsoever in this program. So the answer would be, what's involved is you go to libertydirect.org, and what you'll see is a physicians tab. If you click down, you'll see a section on enrolling your practice. And so as you enroll, it's a fairly simple form. And then there are 3 agreements. Any one or combination of these 3, you can kind of click to execute. One of them sort of attests to the nature of a direct primary care practice if you happen to operate a direct primary care membership practice. The second has to do with attesting to your having health coaching capabilities to coach these provisional members. The third has to do with your functional medicine training to prescribe supplements. So you can check any one of those three agreements and become an affiliated practice. There's no cost to it. If you are a DPC practice, then what will happen is that you'll be contacted by an organization called Hint Health, which is essentially it's a company that makes a software product that manages the membership of a direct primary care practice. And for your Liberty members, you would enroll them inside of Hint Health, and what Hint does is then communicate the need to subsidize that membership fee back to Liberty, so you'd get a check every month for those Liberty Direct members. So Hint is our platform for kind of managing the eligible patient member universe and getting practices subsidized appropriately.
Awesome. Yeah, I've had a couple other questions. Dr. Rajka Milanovic, hello doctor, from Illinois, says, what does Liberty Direct pay for a functional medicine visit?
Well, again, for practices that are direct primary care, you would be the subscription covers the visits. For practices that are billing on a fee-for-service basis, the policy for Liberty Direct as a payer is they basically pay 150% of what Medicare would pay for a visit. So it's a very simple reimbursement formula. My personal belief is that for primary care physicians that are operating in this vein, that this is a great opportunity to begin to explore the direct primary care model. Only because like I said, it makes the financial burden for patients completely go away, and it just creates a very nice kind of platform to transition from. But if you operate on a fee-for-service basis, they simply pay 150% of what Medicare would reimburse.
Awesome. Hey, we've had a few questions here from health coaches. I know health coaches are super excited to get involved in functional medicine. Pamela has asked about how coaches can become part of a functional medicine practice. I mean, I'm going to take this one. My answer to that is start a meetup group. Go to functionalforum.com/meetup, start a meetup group, and invite every functional medicine doctor within 50 miles to your meetup, and invite other doctors to come and watch the show. In October, one of the things we're doing very clearly later on this year is going after clinical topics like digestion and hormone health, that these low-hanging fruit of where doctors are really like, gastroenterologists didn't realize that there was 100 trillion microbes inside of us just like a few years ago. And so now they've come into a new understanding of medicine and are ready to practice differently. but they need to be introduced to this. And one of the best things that happened this summer, one of the most heartwarming moments, was meeting a doctor at the IFM conference who was a regular family physician who had got interested in functional medicine due to the forum, had ended up using some of our resources that we'd recommend, and was now running their own successful functional medicine practice. I mean, that's been the purpose of this since the beginning, if you didn't realize. And it was awesome to to see that happening in actuality. So for those people who have questions about how to meet a functional doctor or how to be involved, if you're a health coach, take the initiative, start a meetup group, and invite them to the group. Again, it's not about you, the health coach, it's about building community, and people are very responsive to that. We've had a question from Roy. He says, has it started? Yes, it has started, because I've signed up and all of my company have signed up. Tom, does Liberty recognize advanced practice nurses as primary care practitioners?
At present, this is a the primary care, the practice owner that is of the affiliated practice needs to be an MD or a DO. However, advanced practice nurses, nurse practitioners, PAs can certainly provide primary care services to members inside of an affiliated practice.
Awesome. And one more question here from Integrative ANP on Twitter. And keep the questions coming in, because we are going to have another Q&A at the end. Hashtag functional forum. Would women be offered female services, i.e. labor and delivery?
They would, yeah. Pregnancy services, labor, delivery, etc., are in fact very much covered in Liberty. Fertility-related things, vasectomies, fertility treatments, those are really, frankly, the fertility category is kind of the only thing that's really not well covered that I've been able to find inside of Liberty. So hospitalizations, ambulances, all of the things that you would think of that your insurance would cover, up to $1 million per diagnosis or per incident are covered. So it's got an enormous kind of coverage limit, and so yeah, with the exception of fertility services, it's I have found it to be really very comprehensive.
Amazing, Tom. If you could stick around for it, we're going to have a few more questions at the end. Thanks, everyone, for your questions, and thanks for sharing. It's a real moment of pride for Gabe and I to be able to bring this forth on the Functional Forum. It's super exciting. No more whining about there's no more insurance that covers a thing. It exists. It's real. You could sign up now. I'm just really proud to be part of this. And thanks, Tom, for all your hard work in making this happen. Please visit libertydirect.org. Have a poke around for physicians. Sign up for yourself, for your family. I've done it.
Thanks so much for watching. And for more great clips like this, please subscribe to our YouTube channel. I've created a special free video just for you called Harnessing the Power of Community in Your Practice. And it'll give you a clinical model, practical tools that double as marketing, and strategies to develop a community of your peers. All you have to do is click on the link below.